Hello, everyone. Welcome to Stevie MD's ECG workout. Today is June 5th and it's Wednesday, and I hope everybody is doing well. So there are a few cases I would like us to look at today. So why don't we just delve right into them without wasting much time, okay? So I'll share my screen and then we would start off from there. So what do we have here today? This is a 55-year male patient who complained of chest pain and shortness of breath. And he had a BP of 115/60. So he's actually awake, he's alert. And then we asked to, dissect this ECG. So I hope it's clear for us all to see. Let me zoom in a bit. Then you have to close a few things. Okay, so this is much better. Right. So this is the ECG that we have, and just looking right up, you can just pick up a few things so quickly. But first of all, you have to go through your basics, right? So the basics, like we all know, checking the rhythm, the axis, and the likes. You can do that on your own, but just to glance through this, we can just easily see and say that this is a sinus rhythm because there's a P before every QRS complexes. Yeah. So this is a sinus rhythm, right? And we can also see some ST depressions and elevations. Can I pick up a pen? Yeah. So let's pick up a pen and go to the board. Right. Okay. So we can see that here, ST elevation in lead 2, lead 3, AVF, right? We can see ST elevations in V1, right? With ST depressions in V2, right? I hope you can all see that. So without going further, maybe I should just take a pause. In fact, I've given you the clues already. So what do you think we are seeing? Well, if you guessed that right by saying it's inferior, acute inferior myocardial infarction, then you're right. Okay, because you're seeing them in a 2-3 AVF, right? But there's something I need to bring your mind to. Okay, this is the sinus rhythm. Yes, you're right. And then we're able to also pick up the acute myocardial infarction. Okay, but how about V1? How about V1? I think I should take a very deeper pen. How about V1? You see, there's also ST elevation in V1. You can see that here, right? And we are seeing ST depressions in the V2. So that would suggest that there's something going on, on the right side, in the right side, right ventricle. Okay. So the ST elevations in the inferior MI, see, whenever there is an inferior MI, you see the elevations in an inferior MI plus an ST elevation in V1 and a depression in V2, okay? Then you should know that there's something going on. I mean, the right ventricle is also involved in the infarction. So this actually was not going to be just inferior MI, right? But it's going to be inferior MI, okay? You're going to have the inferior MI, as well as a right ventricle myocardial infarction, okay? The RVMI as well. Okay, so that is going to be the full diagnosis. That's what the question asked you of the full diagnosis. So this is a sinus rhythm, having an inferior MI and a right ventricular myocardial infarction. That was just that. Okay. So you have the full diagnosis. So that will be for this question. Then we have a second question here. Okay. A 50-year-old man who complained of chest pains, had palpitations, and was brought in by the paramedics. Okay, and we actually find, what we're seeing in the findings, right? So if you would take a quick pause and assess this ECG, try to pick up one or two, and then see if you can arrive at a diagnosis. And see if we can arrive at a diagnosis. So this is a bit tricky, but I think you're going to pick it up. I know you guys are good. Yeah, this was a clinical case, a real life situation. So try and assess it. Supposing the patient was brought in and you were on duty. Okay. As soon as you got the ECG strip, what comes to mind? What do you see? Okay. So, like I've always said, your lead two is key, right? Your lead two and V1, okay? Whenever I get an ECG, I quickly look at lead two and look at my V1s, okay? Because those are the places that you'd, really have things going on and you could easily pick them up. So we can just see that, yes, we are having, let's look at the RR intervals. First of all, you're seeing the peaks also here, right? You're seeing the peaks here, right? Also, then again, this is just easy to pick up. There's what? Left ventricular hypertrophy going on, yeah? Left ventricular hypertrophy. That is going to be the first diagnosis, the first finding, LVH, right? And then when we look at the RR intervals, are they equal? Yes. But it gets to a point, it looks a bit unequal. I mean, irregular, yeah? So you're having, when we map the RR to R intervals in this area, actually they are regular, okay? But when you move on, it becomes irregular, right? Okay. So this is the situation that we have. So whenever you're having such a conduction going on, first of all, when we look at V1, we could also see the RBB, okay, the right bundle branch blocks. These are the rabbit ears in the right bundle branch. So we have picked another problem, RBB, right? RBB. Sorry, my pencil is right boundary branch block, okay? And then let's look at the P waves. Never forget your P waves. Never forget your P waves. So we're having P waves also here, right? P waves, P waves. And sometimes the P waves are even buried into the complexes, yeah, as you see in there. So these, okay, P waves, they look like flutter waves, right? They look like flutter waves. So, and whenever you're having um, regular RR intervals plus some irregularities in the RR intervals, okay, we're having, so to say, some kind of patches here and there, like we're seeing here. Okay, you can have a regular one, then it becomes this irregularity and stuff like that. Okay, then you should know that it's a variable conduction going on, right? There's a variable conduction going on, and overall, you could have in atrial flutters, you could have what overall irregular rhythms, but whenever you're having these patches, okay, or the regular, irregular, regular, irregular thing going on, then you should know that there's a variable conduction going on there. Okay. So actually in atrial flutter, the AV node will conduct impulses to the ventricles at different rates. Could be 2:1, could be 3:1, 4:1, or really 1:1. Okay. So you should just bear that in mind. And then you know that the P waves or the flutter waves would have sawtooth appearance like I showed you. So this is more like, sawtoothed, right? Sawtoothed. You can see that. It's very obvious to see it, pick it up. Yeah. Actually, the presence of atrial flutter may be the first indication of cardiac disease. So you should just bear that in mind. And the symptoms and signs could actually be dependent on the ventricular response rate. Okay, so what we really have here is atrial flutter. You have the atrial flutter. Okay, this is atrial flutter. You have a flutter. Sorry, I need to just um pick up. So this is going to be your full diagnosis. Okay, so you're going to have the atrial flutter with variable conduction. And then we have the RBBB. And then also, what else did we pick up? And then we have the left ventricular hypertrophy, which was very easy to pick up, right? So whenever you want to pick up flutters, don't forget to look at your V1s, right? Look at your V1s, and then you'll be good to go. So this was atrial flutter, easy to pick up, right? Then the left ventricular hypertrophy, then the RBB with the rabbit ears, okay? That was that. So this was supposed to be the diagnosis here. I hope this helped a lot. And so just stay tuned for more and make sure you keep on learning and solving a lot of questions. Yeah, I'll bring you more on this, more ECGs, so that we can just give you some tips and hacks to finding or reaching your diagnosis. Okay. All right. So we're going to stop here and just stay tuned for more. Okay. Thank you and have a wonderful day. Bye bye.